So let's continue next question. Few questions in continuation up to 166 were done. Now 161 onwards, 67 onwards will be there, but few questions in between. 25-year-old female with a history of bilateral vitreous hemorrhage is referred with a bilateral lesions in the cerebellar region. Which is likely diagnosis? What is likely diagnosis? Cerebellar, neurofibromatosis type 1. So what is there? So answer to this question is wall impending sarcoidosis. We'll keep it reserved. 30 years involved in the head collision. He was restrained in the back seat with the lap seat. He evaluated image department and work of remarkable and small bruise is there. That's why this patient was not taken for laparotomy. Its parental nutrition is given. This was discussed in the group. Mild claw, again this patient mild claw regarding whether it is eczema, so cervical rib. So sensation of the forearm is lost, but not arm is lost. So I was expecting it to be the lower level of ulnar injury, maybe the axillemas. So actual question is 157 onwards. From here there is continuity. Which of the following represent the metabolic alkalosis? Continuous alkalosis, loss of acids, and that is metabolic means not respiratory involvement. Continuous nasogastric aspiration. Scenario about recurrent undifferentiated thyroid carcinoma and T3 replacement double with calcium 2000 thyroglobulin 5000 about recurrence of undifferentiated thyroid cancer is there. T3 replacement. Calcitonin is thyroglobulin is primary secondary parathyroidism, whether it is primary hyperparathyroidism or secondary hyperparathyroidism. It is secondary. It is primary hypothyroidism. Hypothyroidism. T3 T4 in normal range. T3 replacement, already T3 is continued, that's why, and TSH is normal. Closure of tricuspid wall occurs at the onset of. This is the wall between atrium and ventricular. It closes before ventricular contraction. So isovolumic. It has to be isovolumic contraction. Closure tricuspid during isovolumic contraction. Closure of aortic walls will be during relaxation. Year-old child with bleeding and pain after defecation, protruding cherry-like mass is jewel polyp. Then first acute phase reactant to rise in 24-hour post-trauma. What will rise immediately after trauma? CRP is there, but acute phase reactant, what CRP? Yes. CRP earliest 6 to 8 hours, peak at 48 hours. Ferritin is late phase. Ferritin is more strongly associated with the chronic phase. Prolactin, procalcitonin, then acute phase proteins are CRP. Complement, ceruloplasmin, these are acute, positive. Transferrin is negative. 74-year-old man who has undergone emergency major abdominal surgery 2 days previously is noted to be confused. He has furosemide for heart failure and plasma sodium. There is hypo. Return upon 5% dextrose. So what will be there? Excessive intravenous fluid administration. That too dextrose. Tourniquet inflation should be done above systolic pressure after exsanguination of the brain, below systolic after. Above systolic after exsanguination. A is the answer. 45-year man with the upper eyelid drop associated with ipsilateral cheek dryness and abnormal pupillary reflexes. Which one of the following ganglion? So it has to be ciliary, or there is dryness of the cheek also. Also with ipsilateral cheek dryness, abnormal pupillary reflex. Pupillary reflex means it has to be ciliary, or what? Stellate. Oh, T1, it is talking about Horner's syndrome. So Horner's meiosis, ptosis, dryness, anhidrosis. That is the Horner syndrome. 18-year male presents to the casualty with depressed fixation, managed surgically over few days. He complained of double vision on walking downstairs. So downstairs double vision, difficulty SO4 has to be there. SO4 olfactory optic oculometer trochlear D. A person suffering from sickle cell disorder develop osteomyelitis, salmonella. What about E? E. coli? D is right. What was the question for E? There was another question which is missing or what? That was 174. 175 is not there. That's why there is some question. This is about steroid ganglion. Site of action of furosemide. Furosemide acts on its loop of Henle, but whether ascending limb, descending loop of Henle, furosemide. 99 filter sodium is reabsorbed and 65% is proximal tubule. This is important. Nuclei of cranial nerve 9 and 10th. 9, 10th, 11, 12th, midbrain, pons, medulla. Medulla has to be there. B. 21-year-old map comes into the emergency department with severe headache and neck stiffness of the recent onset. You suspect acute meningitis and decide immediately to perform lumbar. Which of the third attempt obtains CSF? You notice the fluid is obtained with red, however, collection. Final bottle is not cleared with any blood. What anatomical structure is most likely to be responsible for vertebral venous plexus? SVR low, cardiac output high, CVP high. Low SVR is generally in septic shock. A child bleeding from the little's area. Now again this is greater palatine, sphenopalatine. Anti-arrhyth model, it is sphenopalatine only. Little's area. 50-year man presents with a difficulty in swallowing and alteration in his examination. There is vocal cord paralysis, absent gag reflex, glossopharyngeal. What is this? Difficulty in swallowing on examination. There is vocal cord paralysis and absent gag reflex. Vocal cord paralysis. That's why. So afferent is from glossopharyngeal, efferent is vagus. That's why vagus is efferent is vagus. That's why vocal cord paralysis is with the vagus. Fall on outstage hand, loss of blood supply to scaphoid, proximal distal, it schist from the distal. Loss of blood supply to the scaphoid. Loss of blood supply to scaphoid. So proximal will be blood supply, and blood supply is actually from distal. Patient with a head injury with increased intracranial pressure, which symptom occurs first due to raised bradycardia has to be there. It is bradycardia. I think it is bradycardia. Altered mental head injury with symptom first to occur. Mental status will be late, but immediately there will be bradycardia, Cushing's reflex. Everyone has told D. Where are the arterial baroreceptors located? Carotid, sinus, and aortic arch. What is the most useful test to clinically distinguish between upper and lower motor paralysis of facial nerve? Eyebrows, raise the eyebrow. Why should you remove thyroglossus? Is recurrent infection. What are signs of delayed complication of blood transfusion? Jaundice. Lady with bilateral inguinal lymph nodes. Where will be the inguinal labia minors? Hypospadias is a congenital anomaly. Underlying cause is urogenital sinus. Oh, genital folds, not the sinus. Genital tubercle and genital fold. Yes, folds is there. Median to phrenic nerve when it is emerging thorax from the neck. This is so many brachiocephalic vein, subclavian vein, brachiocephalic. Still people are talking about trachea. Again and again this question is going to be crossed, checked. See subclavian. Popliteal fossa superficial structure, tibial nerve. Fall on outstation with a view of X-ray. Which view? All station, true lateral view. C is the lateral view. COPD smoker with X-ray showing hyperinflation, ABG, PCO2, H2, COPD. PCO2 will be high, both high, A. Thyroid histopathology shows lymphocytes with fever, Hashimoto's. Moving with deglutition, midline swelling moving with the deglutition, thyroglossal cyst. There was a finger swelling with a history of trauma, non-tender, not attached to the skin on the foreign body. What is most likely? Finger swelling, history of trauma, for skin, foreign body. What is history of trauma? Non-tender, not attached to the skin. Dermatofibroma. There was a finger swelling, history of trauma, not attached, not skin, foreign body inside. Foreign body inside. Dermatofibroma is painful. No foreign body inside. It is dermoid cyst. Other skin condition, mole, basal cell carcinoma. Okay. Patient with 3-month history of 10 kg loss, 10 centimeter resistance, Crohn's disease. What is best treatment? Elemental iron diet.